Dr. Welker has been practicing medicine for 36 years. After 16 years in private practice, she became part of the academic mission at The Ohio State University, where today she serves as the Executive Director of the Primary Care Network, Associate Dean for Primary Care, and Chair of the Department of Family Medicine. While in private practice, I provided care to my patients in the best way that I knew how. In addition to that, I became involved in organized medicine as a way to be a patient advocate and to work for the things that would help my patients. Providing high-quality patient care is always the top priority. If you don't have high-quality care, none of the rest matters. Upon leaving private practice, many of Dr. Welker's patients followed her to OSU. Throughout her years at OSU, she has moved to different offices, and her patients have again followed her and remained loyal. Several of her patients have followed her for over 30 years. Dr. Welker is known for the benevolent care she has provided to her patients. Despite Dr. Welker's many executive duties, whether as department, college, or medical center administrator, she still sees patients most days of the week and at least one Saturday a month. She chooses to be on call for her patients, even staying in touch electronically when traveling, said Dr. Christopher Ellison. Becky Wilkins said, "One Friday, Dr. Welker saw a patient for another Reardon provider. The patient told Dr. Welker he hadn't felt well for a while and had been to several offices and seen multiple providers to try to discover what was wrong. Dr. Welker left on vacation later that day, but called me the next morning to ask that I find the radiology report for the patient. She patiently held while I searched through the result reports looking for what she needed. While I am not a clinician, as I read the report to her over the phone, I knew enough to understand this patient was gravely ill. Dr. Welker and I talked a bit more about the next steps for the patient, and she insisted I keep her apprised of the patient's care while she was gone." Sam and Karen Benningfield have followed Dr. Welker from the Reardon Clinic to University Hospitals East, back to Reardon, and a year ago to OSU's new Wellness Center in New Albany. Sam and I first met Dr. Welker about 30 years ago when Sam was very ill. Dr. Welker immediately diagnosed him as an emergency patient, told me not to wait for the squad, but to drive Sam to OSU's emergency room at the main hospital, where she, unbeknownst to us, made arrangements for a fast-track admission and alerted the ER attending physician to ensure that Sam was seen right away. That was the first time that Dr. Welker saved Sam's life, said Karen. Under Dr. Welker's leadership, the department's 8 family medicine sites have been transformed into Level 3 patient-centered medical homes. Dr. Welker currently provides this patient-focused care at the Phillip Health Center for Healthy New Albany, located in New Albany, where she and her husband, Lloyd, reside. Dr. Welker is well known at the state and national levels for her leadership in organized medicine. The first woman to be elected president of the OAFP, she has also served on the advocacy commissions at the OAFP and the American Academy of Family Physicians. Dr. Welker was also elected to a 3-year term on the AAFP Board of Directors and just recently completed 2 years of service as president of the AAFP Foundation. Perhaps her most notable work in organized medicine has been during her 10 years of service on the AAFP Foundation Board of Trustees. With the AAFP Foundation, Dr. Welker has visited several countries to provide much-needed health care to the citizens of the Republic of Georgia, Moldova, Haiti, and several others. Phyllis Ostrov, another patient, said, "She is the kind of person who goes out of her way to keep me and the less fortunate healthy every day. I also became acutely aware of her great knowledge and skills, as well as the endless hours she has worked and her determination to help humanity in its struggle against disease. Dr. Welker volunteers at the Academy of Medicine Free Clinic and the Columbus Free Clinic, a student-run clinic. As an educational experience for medical students, she often has a medical student with her while she is seeing patients. This is just one example of her dedication to medical students by encouraging them to pursue a career in family medicine. Dr. Ellison said, "Dr. Welker is a triple plus threat: a teacher, a researcher, a clinician, and a servant to philanthropy and a servant to those less fortunate. These are qualities that contribute to her being constantly called on by national organizations to mentor other family medicine chairs."